Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Understanding meningitis. An overview. Meningitis is a serious infection. It affects the meninges. The meninges are the membranes that surround the brain and spinal cord. Meningitis can be life-threatening. It requires prompt medical attention. Meningitis can be caused by different germs. Bacteria, viruses, and fungi are the most common culprits. Bacterial meningitis is the most serious type. It can lead to severe complications if not treated quickly. Meningitis can affect anyone. However, certain groups are more susceptible. Infants, young children, older adults, and people with weakened immune systems are at increased risk. Understanding the causes, symptoms, and prevention of meningitis is crucial. Early detection and treatment are essential for the best possible outcome. Causes of meningitis: bacteria, viruses, and more. Meningitis occurs when germs invade the meninges. These germs can reach the meninges through various routes. Bacterial meningitis is often caused by bacteria like Streptococcus pneumonia and Neisseria meningitidis. These bacteria can spread through close contact with an infected person. This includes coughing, sneezing, or kissing. Viral meningitis is the most common type. It is typically caused by viruses like enteroviruses. These viruses are highly contagious and can spread through respiratory droplets, fecal matter, and contaminated surfaces. Fungal meningitis is less common. It is caused by fungi that are typically found in the environment. People with weakened immune systems are more susceptible to this type. In some cases, meningitis can also be caused by other factors. These include parasites, certain medications, and head injuries. Recognizing the signs and symptoms of meningitis. Meningitis symptoms can vary depending on the cause and severity of the infection. However, some common signs and symptoms include sudden high fever. This is often one of the first signs of meningitis. The fever may be accompanied by chills and sweating. Severe headache. Meningitis can cause a throbbing headache that feels different from a regular headache. Stiff neck. This is a classic sign of meningitis. It may be difficult or painful to touch the chin to the chest. Nausea and vomiting. These symptoms are common in meningitis and can lead to dehydration. Other symptoms may include sensitivity to light, also known as photophobia, confusion and disorientation, seizures, and in some cases, a skin rash. Section 4. Diagnosis and detection confirming meningitis. Diagnosing meningitis requires a combination of physical examination and laboratory tests. A doctor will first perform a physical exam. This will include checking for signs of meningitis. These signs include fever, stiff neck, and altered mental status. If meningitis is suspected, a lumbar puncture, also known as a spinal tap, is performed. This procedure involves collecting a sample of cerebrospinal fluid, or CSF. CSF is the fluid that surrounds the brain and spinal cord. The CSF sample is then sent to a laboratory for analysis. Tests are conducted to identify the presence of bacteria, viruses, or fungi, determine the specific type of germ causing the infection, and assess the severity of the infection. Section 5. Protecting yourself and others. Meningitis prevention. Preventing meningitis involves a multifaceted approach that includes vaccination, hygiene practices, and other preventive measures. Vaccination is one of the most effective ways to prevent certain types of meningitis. Vaccines are available for meningococcal disease, caused by Neisseria meningitidis, pneumococcal disease, caused by Streptococcus pneumonia, and Haemophilus influenzae type B or Hib. Practicing good hygiene is crucial in preventing the spread of germs that can cause meningitis. This includes washing hands frequently with soap and water, covering coughs and sneezes with a tissue or elbow, and avoiding close contact with sick individuals. Other preventive measures include maintaining a healthy lifestyle to boost the immune system, avoiding smoking and excessive alcohol consumption, and being cautious when traveling to areas where meningitis is common. Section 6. Treatment and recovery. Managing meningitis. Treatment for meningitis depends on the cause and severity of the infection. Bacterial meningitis is a medical emergency. It requires immediate treatment with intravenous antibiotics. The specific antibiotics used will depend on the type of bacteria causing the infection. Viral meningitis often resolves on its own without specific treatment. Supportive care, such as rest, fluids, and over-the-counter pain relievers, can help manage symptoms. In addition to antibiotics or antiviral medications, other treatments may be necessary. These include corticosteroids to reduce brain swelling, anticonvulsants to prevent seizures, and oxygen therapy to improve breathing. Recovery from meningitis can vary depending on the severity of the infection and the individual's overall health. Early diagnosis and treatment are crucial for the best possible outcome. UMCC, your ultimate medical consultant connectors.